Many of our viewers and friends are looking to expand their families and are thinking about having a baby. Unfortunately, this topic isn't always covered in school, or sometimes these chapters are skipped. People also often feel uncomfortable discussing it with friends, leaving them unsure how to try for a baby. This can lead to many misconceptions. We've put together a list to help clarify these points for our viewers today. Let's assume you and your wife are planning for a baby, and you want to understand when to have intercourse and how to maximize your chances. You need to understand that ladies have a cycle called the menstrual cycle. During this cycle, women typically experience bleeding for 3 to 5 days. After the bleeding, an egg is released, and then after some time, bleeding occurs again. On average, a cycle can range from 28 to 30 days. Understanding your partner's cycle. First, you need to understand the duration of your partner's cycle. For example, let's say today is March 30th. Our next period is expected around April 24th. From April 24th, you would subtract 14 days. This brings you to approximately April 10th. There's a high chance that her egg will be released around April 10th. So, to find the likely day of ovulation, you subtract 14 days from the date of the expected next period. That day is when the best chance of egg release occurs, and your sperm needs to be present in that area at that time. Now, let's understand this. If sperm is ejaculated into the wife, meaning you have intercourse, it can typically survive inside the uterus for 2 to 5 days. The egg, once released, can also wait for sperm for about a day to start the fertilization process, baby formation. Timing intercourse for conception based on this. If your wife's ovulation day egg release is April 10th, you should start trying 2 to 3 days before that date and continue trying for 1 day after. This means you'd begin around April 7th or 8th and continue until April 11th. If you're planning for a baby, you should have intercourse at least every other day or even daily. Both methods are effective. However, many patients' wives don't have very regular cycles, or there can be variations because everyone's body is designed differently by nature. In such cases, if couples aren't conceiving using this fertile window method, we recommend downloading a mobile application. Many apps nowadays can track cycles and fertility. If you download one and input your wife's past period dates, it can predict the most fertile window for conception. You can then plan accordingly based on the app's suggestions. If even after trying with an app, you're not conceiving, the next step is to use an ovulation kit. These kits usually come in sets of 3 to 4 or sometimes 5. Your wife will need 2. Urinate on the kit, and when an extra red line appears, it indicates that an egg will be released within 24 hours. At this time, you can even try to have intercourse twice within a day. These are some basic ways to know when the egg will be released and when sperm should be present. Dispelling common misconceptions even after trying these methods. Some misconceptions might still bother you, such as, what position should we use? Many patients say, "Doctor, the semen comes out. How will our sperm reach the uterus then? And what about diet and drinks?" There are many myths and misconceptions surrounding this. Here are some important points to keep in mind. Avoid infections. During this period, it's crucial that neither of you has a cold, cough, or any infection, as these can be harmful to the baby. Folic acid is crucial. If your partner is trying to conceive with you, or has made up her mind to, she should start taking folic acid tablets at least. This can reduce the chances of birth defects in the child later on. Folic acid should ideally be started 2 to 3 months before planning for a baby. Intercourse position. Usually, for intercourse, your partner should be in a position where the semen can be deposited by gravity. There's no special need to put a pillow underneath or anything like that. While many couples try to use this, it's not essential. Semen leakage is normal. It's completely normal for some semen to come out after intercourse. There's no need to worry about this. Sperm will naturally adhere to the vaginal walls of your partner. There are crypts or folds within the vaginal walls where sperm can hide. Studies have shown that if your sperm is healthy, it can reach the uterus within 5 minutes of intercourse. So, it's not necessary for the wife to lie down. For 15 to 20 minutes, she can get up and urinate. It shouldn't cause any fertility problems. These are some common misconceptions that I felt were important to address for those planning for a baby. Next steps, if you're struggling first, track your wife's cycle to see if it's regular. Then try using the fertile period method based on her cycle, or download a mobile application and use that. Alternatively, use ovulation kits to determine the exact day of egg release. Start trying 2 to 3 days for that day and continue for 1 day after. If you've been trying regularly for 3 to 6 months and haven't conceived, consider exploring the next methods. If you've been trying for a full year and still haven't conceived, you should definitely consult an infertility specialist or a gynecologist. They will evaluate both the wife and perform a semen analysis to determine if there are any issues. Friends, hope the methods I've explained and the myths and misconceptions I've cleared up will be beneficial to you. If you still have any misconceptions, please write them in the comments section or send us an email. We will try our best to answer them. If there's a need for another video on this topic, if many more myths accumulate, we'll be back with another video for you.